Namaskar. This is Janisha Sharma.
And this is Saksham Garg from DAV Model School, Sharma and Saksham.
Various Sanskrit shlokas point to the fact that Swasthya eva Jeevanam. And today we'll be expounding about something which is intimately related to your health. Any guesses? Well, it is your gut.
A medical professional once said, all diseases begin in the gut. So today we are going to acquire some knowledge between the correlation between the gut and a disease called depression. So I was wondering what actually gut microbiome is.
The gut microbiome refers to all the microbes present in your intestine which act as another organ which is equally crucial for your health.
Do you know that the gut microbiome affects the body from the birth and throughout the life by the processes like the digestion of food, central nervous system, immune system, etc. The gut microbiome also affects the brain health by producing brain chemicals and communicating with the nerves connecting to the brain. So, are you aware of the gut-brain connection?
Yes. The gut has a direct effect on the stomach and the intestine. A troubled intestine can send signals to the brain, just like a troubled brain can send signals to the intestine. Therefore, a person's stomach or intestinal distress could be the cause of anxiety, stress, or depression.
Given how closely the gut and the brain intersect, it might be easier for you to understand that why you might feel nauseated before a presentation and have intestinal pains during the times of stress. Do you know what depression is? Depression, a major depressive disorder, is a very common and medical illness by which the people can feel negatively, by which the people can have negative thoughts and it can affect negatively the people, the way they think, act, etc.
Are you aware of the connection between depression and gut? Recent research shows that the gut microbiome may even affect the mental well-being of a person by making them more or less susceptible to mental health conditions like depression.
Factors contributing to the differences between the gut composition include medication use, diet, alcohol use, smoking use, and drugs. So, is there any way to treat depression?
Yes, depression can majorly be treated by 3 ways: medication, psychotherapy, and electroconvulsive therapy.
Brain chemistry may contribute to an individual's depression and may factor into their treatment. So, medication might be prescribed to an individual for modifying one's brain chemistry.
Psychotherapy or talk therapy is sometimes solely used to treat depression. In certain cases, improvement can be seen within 10 to 15 sessions.
Electroconvulsive therapy is a therapy which is exclusively reserved for the patients which have severe major depression and who have not responded well to the other treatments. In this therapy, a brief electrical stimulation is given to the brain and when the patient is under anesthesia.
To conclude, it is advised that to reduce depression and increase beneficial microbiome, one is suggested to maintain a good lifestyle, to have a good diet with loads of vegetables and less fats, to exercise more, to avoid stress or unnecessary anxiety, to avoid the intake of antibiotics and to take in prebiotics and probiotics as required.
So one takeaway from this discussion is to keep your body healthy always because it is the only place you have to live in.
At last, we would want to say, Sarve Bhavantu Sukhinah. Dhanyavad.